My name is Elizabeth Harden, and I will be discussing the Baylor Healthcare Institution and the PPM that is installed there. Baylor, Scott, and White have 48 different hospital locations, about 900 patient care sites, about 6,000 active physicians, and a little over 48,000 active employees. They are located all over Texas, mainly in the Dallas, Fort Worth, Little Rock area, but they do have other locations that extend out. But they are all located in Texas. They have a total of 1,025 licensed beds. They are a major refer center, so the majority of referrals that happen in Texas, you will be sent there. They have a variety of specialties such as diabetes, heart disease, cancer, hair loss, infectious disease, pediatrics, weight management, drug abuse or alcohol abuse, digestive diseases, and the list goes on. The majority of these specialties will be located at one specific institution. For example, their pediatrics is a completely separate building, as well as their heart disease. Baylor Healthcare System Professional Nursing Practice Model is based on the AACN Synergy Model for Patient Care Development by the American Association of Critical Care Nurses, and it also includes the 3 A's of professional practice, which is going to be authority, accountability, and autonomy. And it also will include the 6 healthy work environment standards, which is skilled communication, true collaboration, decision-making, appropriate staffing, appropriate recognition, and authentic leadership. They also have the component of the 8 clinical competencies, and those would be clinical judgment, response to diversity, caring practices, advocacy for patients, facilitation of learning, collaboration, system thinking, clinical inquiry, and they also talk about the 8 areas of patient needs, which goes on to be predictability, the complexity, resiliency, vulnerability, stability, participation in the care process, participation in decision making, and the resources available to the patient. I believe that with all of these put together, the components of the AACN Synergy Model is one that is an excellent, diverse model used in the healthcare system. The nurses develop in a way to improve themselves as well as care for the patients. Through this framework, you learn how to be patient, kind, and considerate of what needs to be done for the patient and their family and how to explain that process to them. I think this structure provides a good framework for nurse practices and performs a holistic assessment to determine how predictable, complex, and stable patients are and will be. It helps identify vulnerabilities that create risk, such as pain, at risk for falling, sedation, not eating, a patient in restraints, a patient that's immune system is compromised, a patient that could be hard to or unable to understand English due to a multitude of things. And with this, I believe that it helps structure a nurse for any type of situation, but doing it with such a complex and stable mindset that they will not panic or scare the patient. I also feel like it evaluates a patient's resilience and how he will respond to treatment and is returning to the pre-hospital state that they were in. With this, we know which of our nurse competencies are needed and at what level to make the optimal contribution to safe passage for the patient. We ensure adherence to professional nursing practice by making the 3 A's fundamental to all we do. Given the impact and influence of the environment on outcomes, the contribution and efforts to fulfill the healthy work environment standards benefit not only the patient and their family, but also the healthcare workers involved. And I believe that the PPM does well to establish and cover all people in the healthcare facility, and it gives everyone a great approach to care and consideration. I believe the adaptation of this model really does a roundhouse review on the care that the nurses are being given by patients and by other staff members, and they're not being overlooked or go unrecognized for their efforts. And I believe that it also takes the patient into major consideration during this time period, because they are vulnerable and they are in a position where they might be scared of healthcare workers due to past events. And I think learning the PPM that's provided to this facility, you can understand that they not only take accountability for their actions and what happens to the patient, but they also take accountability for themselves and the family members that are also affected by anything done. I also think that going through and understanding the 8 clinical competencies, the 8 areas of patient care, the 3 A's, and the 6 healthy work environment standards. After reading over this, I believe that this is one of the most excellent PPMs that I have seen, because it does a roundhouse review, and this review and the model that they have looked over is really shown in all 48 of their hospitals, because they have one of the highest standards of care in Texas at the moment. Thank you.